Yeah.
Can we start, ma'am?
Sure.
So, dear friends, very good evening. And with almost 1 week, what we have started our different activity related to our AACCI Week celebration 2024 with the theme of the decoding the modern parenting. One more very important session that we are going to do. We had combined our international forum of the AACCI activity monthly with this today's AACCI Week celebration. And our international speaker today, Dr. Anagha Jaykar, is very well known in our own adolescent group. So I requesting our AACCI Executive Director, Dr. Swati Bhai Madam, to welcome you all, and then we can start our proceedings.
Good afternoon, everybody. Welcome on this very special session of AACCI Week, which is combined with our international forum. And a very special guest is the coordinator of AACCI International Forum from Hobart, Australia. And that is why we have kept this suitable to her from the Hobart zone, that is 3:30. This is my peak sleep time, so normally I avoid, but Anagha is a close friend over last 30 years, ever since my IAP days. And so I had to attend her program. She's an expert who's dealing with trauma and sexual abuse, forensic sexual examination. She has been a speaker in many IAP conferences, as well as many adolescent conferences. And she has also come on AACCI platforms. So it's always a pleasure to listen to her. Those who attended the ITPA in 2019 know that she gave a wonderful lecture on gender dysphoria, which was a new topic for many of us at that time. Thank you. Samir, you can go ahead.
Right. Before I start, I just introduce our today's moderator, Dr. Sandeep Kavre from the PCB Pune and very active member of the AACCI. He is a really forefront volunteer of the AACCI. So welcome, Sandeep. And I just start with the presentation related to AACCI introduction, and then you can take over for further proceeding. Okay?
Yes, sir. So the screen is completely blacked.
No, I am just sharing again. Is it visible now?
Yeah.
Yes, sir.
Yeah. We all know AACCI is working since 2008 with its pillar that teacher, parent, and children and youth. And we have already added one more pillar, that is grandparents. And with that, we are doing our own urban based work for our children and adolescents, which our aim and objective to improve their health, lifestyle, and with a healthy way to accustom with their own regular stress level. This is our board of directors, made up of our late Dr. Adi Lele, our honorary founder chairperson, Mr. Yashwant Bhave, honorary chairperson from 2022, our executive director Dr. Swati Bhave, and our honorary secretary Mrs. Sarmila Lele. Our national core group consists of myself, Dr. Samir Shah, Dr. Anuradha Suvani, and Dr. Surekha Joshi. Our whole forum will be taken care by our own enthusiastic in charges, Dr. Prasant Karya, Youth Forum in charge from Surat, Dr. Sandeep Kavde, Parent Forum, Dr. Shalja Mane from Teacher Forum, and Dr. Anjali Saxena, Grandparent Forum. We have get total 4 regional centers and 8 city centers, which now international center is also working very well under the leadership of the Dr. Don Grandes and the Dr. Anagha Jaykar. We have 250 individual volunteers from the across the India and the international platform also from the 226 cities of the India. We have already discussed. We get 4 forums. Now I handing over the today's for the regarding introduction of the today's speaker with a theme of that understanding the vicarious trauma to our moderator Dr. Sandeep Kavde. Sandeep.
Thank you very much, sir. Thank you, Bhave ma'am, for this opportunity. This series has been a wonderful opportunity to listen to many stalwarts. We have listened to Dr. Donald Degenes, then we had a session with Neil Suarez sir, and today we have an opportunity to hear Anagha Jaykar ma'am. She's a community pediatrician head at Tasmanian Community Pediatric Service Center at Australia. Her special interests are child protection, neurodevelopment, trauma, and disorders. We had that fortune of listening to her ma'am during the ITPA session in Pune, and she had covered the topic of gender dysphoria, which was for me a very new approach, new topic, and the level of discussion and the depth of understanding of the topic and of a perspective from an Australian perspective, which she faces day in day out, is quite different from us. And this international webinar series gives us all a chance to understand how deep this thinking goes. And we have started to just explore these topics today in India, but this new perspective will help us understand how much we have to reach and go. Today, the topic of vicarious trauma again is something which we are new to. But I hope that by the end of this session, we'll have a very different and new perspective to the topic. I welcome Jaykar ma'am for this session and hand over the floor to her. Thank you, ma'am.
Thank you so much, Dr. Sandeep, for the introduction, and Dr. Sameer Shah and Dr. Swati Bhave. And Dr. Swati Bhave, especially for persisting that I continue to do stuff with AACCI. I'm really grateful to you, Swati, for all the encouragement you have given me over the years. All right. So I just thought I'll talk about vicarious trauma mainly because, you know, we are a helping profession. We are so keen to do everything to help others that we very rarely think of ourselves. And then doctors and, you know, counselors and professionals have to think of themselves while they're doing all the work. So vicarious trauma is related to that. Can I have the next slide, please, Dr. Sameer? Yep. So really, because as I said, we have to improve our understanding of this subject. We walk alongside the families. We listen to their stories. We invest emotionally in them. We are human, so it will impact us. And we don't often consider ourselves because every day you go to work, you try to be a person of hope, and that itself can be draining. But you really can't pour from an empty cup. And that's what I wanted to bring to your attention, this subject, because it's not something I have considered as important in my life prior to doing so much child safety work that it's really important to consider. Next, please. So next slide, please. Yeah. So that's what we want. You know, we want our kids to be happy. We want us to enjoy life, but sometimes we can feel a bit down. So that little smiley face can go sad, can get angry, can get upset. So we have to think of all of the uh, aspects of the work we do and how it impacts us. Next, please. Next slide, please. Yeah. So there are overlapping constructs that are often used interchangeably. And I just wanted to give you all a little bit of a perspective on what the different terms are. So vicarious trauma actually is a loss of a positive sense of self and world as a consequence of working with traumatized others. Now, the traumatized others could be people we directly know, or it could be, you know, what we see on the news, what we hear about. And there's a lot of things. I think there's some things which are coming in the
crosses are coming. Should I share from my screen, Samir?
It will not come, ma'am. I was just working.
Okay.
I just change over my host part to the other my device.
Okay.
It will not happen.
Okay. So that's vicarious trauma. Now, what is compassion fatigue? Compassion fatigue is, you know, we have this high level of caring or empathy for individuals who are in extreme difficulty. And then, you know, there's a gradual lessening of empathy over time because you're depleting our own resources because of this high level of caring. So that can become compassion fatigue. And what is burnout? Burnout is when over a prolonged period of time, you get exhausted, you get cynical, you feel inefficient, and then this is a serious inability to perform your job. So they're slightly different. These are overlapping constructs and they can often be used interchangeably. Right? Next, please. Next slide, please. So some definitions are important. And the next thing is really vicarious trauma was identified first in the 80s, 1980, and it was the cost of caring. Okay. It is like PTSD, which we know about, that's post-traumatic stress, but it is like re-experiencing it, numbness, a persistent avoidance, etc. And it is part of the DSM-5, which is the Diagnostic Statistic Manual, which are used in psychiatry to label, diagnosis. And this is a cluster of trauma, stress-related disorders. It is secondary traumatization, or it can be called as insidious trauma. And this is the emotional residue of exposure to traumatic stories and experiences of others, mainly through our work, of witnessing things from afar, and the pain and terror that others have experienced. Horrible stories told, we can share those stories, we can hear the news, we can be impacted by all of it. Okay, it can lead to PTSD if it is unaddressed. Okay, if it's a job related risk that is unaddressed. Next slide, please. And if you have not heard about it, it's worth actually considering how it impacts us, because trauma or neurodevelopmental trauma, I'm not talking of the physical trauma, I'm talking of the psychological trauma. It needs to be understood, it should be managed and worked through and monitored, because it can leave a residual presence that can have a cumulative action. And then we can feel a bit dissociated with the work we do. Okay. And so this is really the work of a therapist, a counselor, and I think doctors all are giving advice, so they can be considered as, therapists in that sort of a role or counseling, because it can really, sometimes you can relate to those things and you can change your own experience. Okay, so this is considered as a psychological consequence of empathetic labor. Okay, technically it could be considered as an irrational response, but these responses are actually normal adaptations as a self-protective protection mechanism. Okay, because we have to learn how to deal with these ongoing exposures. So there is something called as a self-development, constructive self-development theory lens, and you don't really need to go into the details about it. But next slide, please. But what it really means is that it is how our experiences shape our understanding. And there are five components of the self, and how our perception of ourselves and the world we live in develops. It's from infancy till adulthood, and it's an ongoing thing. So you have the frames of reference from which we function. You have the capabilities and the capacities which we have. We have the ego resources. We have our psychological needs and our understanding of the cognitive schemas. And you have the memories which can keep on coming, and the perception of what we have understood of those memories. So the schema that deal with safety, trust, self-esteem, intimacy, and control can often get disrupted when we are considering, vicarious trauma. Okay. So it is really also, you have to also think about countertransference. And what is countertransference? It is the emotional response to the client or the patient and their experiences, which can resonate or connect to our own life. So something that they are experiencing and you have experienced, that can become a sort of transference, and you have to be just aware of it to understand it. Don't have to, because we see that deals with cumulative trauma, and countertransference is individual clients, but they can be mutually reinforcing. So if the experience of the person has got some trigger for you, you have to think about, okay, this could be countertransference. Next, please. Next slide, please. Yeah. So looking at the symptoms and signs, okay, physically we can get exhausted, we can have some sleepless nights, you can have a sore backache, headache, you can be increasingly susceptible to illness, sometimes GI symptoms, irritable bowel, palpitations, hypochondria, are physical symptoms that can come, which could be insidious, and we are not aware it is because of the stress we are holding in our bodies. The behavioral thing could be anger, irritability. Sometimes you avoid some patients. Sometimes there's an increased use of drugs, alcohol, watching excessive TV, looking at, traumatic sort of media entertainment, avoiding colleagues, lots of things, feeling helpless when you're hearing a difficult story, feeling unskilled in the job and feeling you're an imposter, that you don't have the capacity to deal with this. Yeah. And thinking about quitting your job, compromising patient care, lots of negative gossip at work, impaired appetite, binge eating. So lots of symptoms and signs. Not everything is trauma, but you have to think when this happens, is there something that you're sort of stressed about? Next, please. Next slide, please. And then the emotional, psychological signs are really getting exhausted, having a negative self-image, depression, anxiety, hopelessness, guilt, numbing effects, suicidal thoughts, diminished sense of enjoyment, failure to nurture and develop non-work related aspects of life. So there's a very broad range of signs and symptoms which could come up, and unless you are self-aware, it may not be something that you have considered. And that's why I wanted to bring it to everybody's attention, because it's not something doctors consider often. Next, please. Next slide, please. Okay, so workplace related symptoms could be behavioral. So if the person changes jobs frequently, there's anger, there's absenteeism, going out to avoid being alone, irresponsibility, overwork, exhaustion, staff conflict in the team, blaming others, interpersonal relationship stuff, lack of collaboration, withdrawal, poor relationships. Sometimes our personal values and beliefs could be affected, having a sense of dissatisfaction, detachment, also worrying about not doing enough, lack of appreciation of what others do, lack of interest, lack of caring. And in the job area, it could be lack of flexibility, avoidance of responsibility, increased sort of errors, decreased quality. So there are lots of work related symptoms that can be possible and need to be considered. Next, please. Next slide, please. Yeah. So when you look at the literature and the review of literature, the sort of causes for vicarious trauma could be organizational or individual. So if there is a personal history of, having some maltreatment, there's a higher risk of vicarious trauma. If you're not trained about how to manage and coping strategies, there's a higher risk. If you have a lack of work-life balance, then there is a higher risk. If you're unable to share your emotional challenges for whatever reasons, there's a higher risk that you can have increased chances. And actually, if you don't use self-care techniques, you have a higher risk. This is what the literature tells us about vicarious trauma. Next, please. Yeah. So when you look at studying the causes, if your workload, volume, and the ratio of the work you do is too high, it's a higher chance of having vicarious trauma. If you in the workplace you're exposed to aggressiveness, I can see lots of doctors being threatened by patients, and having a safety issue in your work environment, that can lead to a stressful thing. And if your organization does not support you, or the work culture, the ethic does not support you, there is a greater chance. There is a sort of divided literature about whether the number of years you work are protective or a risk factor, because the more experience we have, sometimes we have better coping strategies, or you are exposed and you don't feel supported, then there's a higher risk of feeling dejected, or nobody's appreciating me, having imposter syndrome, etc. So when people are working in the sort of child protection space, and if the people who are working, they have a higher ACE is adverse childhood experiences. If they have a higher incidence of adverse childhood experiences, then they have what they call as a higher level of compassion satisfaction. And because they're doing something they feel is worthwhile, it's a sort of protective factor against burnout. So these are studies which have shown, I'm not discussed in detail, but I'm just giving you an overview. And if there's current personal stress for whatever's going on in your own lives, is going to add a higher risk. Okay. And the last but not the least is the level of control you have in your job. If you're working with a boss who doesn't understand your sort of work-life thing, or you're such a junior that you have to listen to what the people say, irrespective of whether they are right or wrong, then you've got a greater chance of feeling stress-related, uh, burnout, etc. Next, please. Next slide, please. Yeah. So now we know what it is. We know what the symptoms are. We know what the causes could be. What are the things we can do about it? Okay. So what you have to do is think of the ABC. That's an easy way: awareness, balance, and connection. Okay. Those are the three things we have to keep in mind. But if you identify this, okay, for an individual, it is basically very simple. Monitor yourself, eat well, rest, and exercise, and seek balance. Engage in outside activities. That's what we call as self-care. There are many things you can do under the guise of self-care, and it depends on what you enjoy. And as long as it's outside the work activity, whether you're an artist, whether you're a singer, whether you're a dancer, you want to walk in nature, you want to meditate, you want to talk with friends, whatever it is, you have to seek a balance between your work and the rest of your life. And then the other thing that individuals need to consider is, how do they set professional and personal boundaries? Because sometimes they just merge and you don't have those boundaries in your own head or in your life. Okay. And sometimes also take advantage of professional development opportunities where you learn different things and you learn about all this, so it's really important. And then, you can utilize some evidence-based treatments that focus on changes in thinking and cognitive processes. Yeah, you can do CBT counseling if that's where you need to go. Next, please. Next slide, please. Yeah. But also, it's not just your own responsibility, it is also the work environment that you have to change. So if you own your own hospital, say a small hospital, it's really important you consider not only your own self-care, but also the well-being of the people who are working with you all. Okay. So considering organizational level and then societal level. So organization level, if there's been a like reducing workload to make it, uh, and exposure to challenging cases, it's not always possible, but trying to see how you can balance that. And if there's been a critical incident, sometimes having a debriefing, and that means not only the problem solving, but also how do people feel about it? What are they doing? Acknowledging that it can be quite traumatic and be able to address, or at least allow the people working in that thing a chance to be heard. Okay. EAP is sort of professional counseling, where you can have in-service trainings on self-care, etc. Providing leave, professional education, sometimes, going as a group and doing some community service, and y'all are all doing it, so I don't need to preach to the converted, but doing things that give you a satisfaction is a great intervention as a group or as an organization. And then looking at having a specially trained therapist to assist with cognitive changes, etc. All right, next, please. Yeah. So the protective factors in organizations where people work in traumatic environments, and this could be the police, it could be, emergency workers, it could be doctors who work as residents in the ED or in ICUs, or, anywhere where there is trauma involved, and that could be a stressful thing. If there is appropriate intervention and supports for the staff, it's a healthier workplace. Okay. And the networks could be peer networks, yeah, and that they can offload, but not on everybody, when the other person is ready to listen. And when we say space matters, it's the space between time, allowing some time for reflection, allowing time between patients, making sure you have time for eating, time for just chatting, and you have your organization being very vocal about the importance of self-care and well-being in your environment, and also helping us and the workers who are involved in our teams to have a boundary between home and workplace, not calling, them about work when they're off work, and supporting people to distinguish between professional and personal lives. And I truly believe in India we merge them almost very easily, like, and it is important to understand that your professional life is one aspect, your personal life is the other, and manage having that work-life balance. Next, please. Next slide, please. Okay. And then what I wanted to bring, it's not all doom, because there is something called as vicarious resilience. Okay. So what does that mean? Okay. To understand that you have a vicarious resilience informed approach, that means you celebrate small wins and talk about the good stuff. What are the nice things that have happened? Strength-based stories. Yeah. And having an organizational relationship with the managers or the people, hierarchical, the bosses or the team leaders or the consultant who has a team of registrars, working as a power with rather than a power over approach, and that makes a huge difference to vicarious resilience, and that there is a freedom to work through solutions, that you can offer some solutions will lessen the impact of trauma-based work. Okay. Also, I think putting some money aside, I don't think India's got that funding-based healthcare, but putting some money aside for protective, predictive strategies, putting some time aside to give people understanding of what is resilience training, how to develop our own resilience to deal with all the stuff we do. Next slide, please. Yeah. So the protective factors for us is embedding education and ongoing training about this stuff, celebrating success, celebrating the of accomplishment in the work we do, developing vicarious resilience strategies, and sort of, again, this is flattening of the hierarchical structures of boss, junior, senior, and having a power with having a team-based approach and a team-based culture. Yeah. And having appropriate supervision that allows for consultation and being able to talk openly, particularly about challenges, because supervision is really talking with your senior about a protective factor and management strategy, which allows debriefing, which is non-judgmental, is a safe place and supportive of self-care. So it's really a culture of fostering well-being, which is really important to consider in the teams that all of you all work with. Next, please. Yeah. So vicarious resilience can also be called post-traumatic growth and compassion satisfaction. Okay. When the meaning and purpose of the work we do can be enhanced through trauma. Okay. So there is a traumatic incident which has happened, and the dimensions which are there can change your life goals and perspectives. Yeah. And all of us have experienced some traumatic incidences in our lives, be they big or small. Yeah. Then the clients or the patients we work with, if they've got success, that can inspire hope, not only in us, but in them, and it gives you a sense of satisfaction. And also sometimes you can recognize that the patient's spirituality is a therapeutic resource for them. So it may be spirituality, it could be the self-care they're doing, whatever they're doing, they have their own therapeutic resource. So we are not the ones to always shape their therapeutic this thing. We're just there to guide them and support them and allow them to find the resource within themselves as well, and get increased self-awareness for ourselves, and increasing our self-care practices will help us with vicarious resilience. And really also being aware of the power and social function, the power dynamic and the power of working with rather than on, and also accepting that we can be quite resourceful in the way we do things, because I think as an example, I can say AACCI has been really resourceful in sharing the information across, for a lot of the stuff that is doing, and which is not related to trauma, but is really a satisfaction. It's a compassion satisfaction that you're achieving whatever, through doing, through being resourceful. Yeah. And then we have to also be, have an increased capacity for attentiveness to the parents or the grandparents' narratives of trauma, their stress, their caregiver responsibilities, their caregiver burnout, and all those things. Just being compassionate about it will give us the satisfaction for the work we do. Next slide, please. I think I must be coming to the end of the slides, but next. Is there one more slide? Dr. Samisha?
Smith, sir.
Okay, till they change the slides, are there any thoughts or any ideas, any thinking about it?
Anagha, can you give us some real life scenarios which you have faced? And okay, last one, the slide is there.
Yeah, so this is basically a summary of Vicarious Resilience,
Yeah.
which is first coined by, in 2007, which is the unique and positive transformation that can occur between therapists and clients as a result of witnessing the resilience and recovery of trauma survivors. So the key is having an awareness of yourself, what is happening to you in relation to your patient and your own needs, prioritizing self-care, having a supportive workplace, workplaces that support workers to reflect, access adequate supervision, and take the time for self-care is really important. All right. I think that should be the next slide is just a picture.
Yeah.
Yeah. So the thing to remember is collective care. Okay. So you have self-care, but you also have what we call as collective care, because as a team, we can look after each other. And self-care is important, but collective care is equally important. And giving the examples of vicarious trauma, there are plenty, but what generally happens to us, so I'll start with my experience, and then I'd like you all to share any experiences that you all think about on this topic. So one of the things we do is sexual abuse assessments for children, and sometimes that can be very traumatic. The stories we hear can really, you think, how can human beings be so, uh, difficult, and how can they not understand, especially if it is something which is happening in a familial setting, or then there's family violence, or there are adverse childhood experiences. It affected me more when my children were that age, and now my grandchildren are that age. So if you think about it, you just can't understand human nature. And so it's really important. So what, as our team, because we are dealing with child protection cases all the time, okay, so you're dealing with any adverse experiences that children have. And so what we have set up as a group is we have something called as a well-being hour. So every week for 1 hour, we sit down and have a cup of coffee, or we'll go for a walk. We'll do something as a team to look after our own well-being, because as you said, until your cup is full, you really can't help somebody else. It's the the airplane thing, put your own mask. And then so we allow ourselves to actually think what's working well in our lives. What are the names of our dogs, or what are the whatever, what are the things. So it's really important that we have opportunities for people to debrief about the stuff, to give them some time to process it, to understand where they're coming from, and focus on the well-being, which is other than just work, work, work. Of course, work is important, but looking after each other in the space of our work is equally important. Okay.
Thank
Yes,
you, Anagha.
Dr.
That was a
Cowdy.
wonderful, wonderful
Yeah.
lecture. And we really understood, and it's so
Yeah.
important for all of us, especially
Yeah.
who are dealing with mental health issues. Like I'm
Yeah.
doing counseling day in and day out. And sometimes I also feel when I see these dysfunctional families and when I see the parent and the child discoordination, sometimes I
Yeah.
also feel, is it worth continuing this? Because you feel so sad for the situation both the parents and the teens are undergoing, especially
Yeah.
in today's world. But as you said, we have to take self-care and we have to get motivated and see the success rates, the family
Yes.
dysfunctional which we brought together, the
Yeah.
teenagers which sort of settle down, and that feels really nice. So that is how we're going. And talking of real life experiences, not as a
Yes.
therapist, but I'm sure all of us have seen this, that when we
Yeah.
are dealing with specially challenged children, and when
Yes.
we see their parents day in and day out,
Yeah.
and some of them literally give up their life for their kids. And they are so invested and so involved that they go into a caretaker burnout syndrome. And we really have to counsel them that they need to have some time out for themselves. And they should not feel guilty about keeping their children for a short time with some responsible caretaker, but have a vacation or some space for their own. Similarly, we
Yeah.
also find that when there are unmarried girls or somebody taking care of their very seriously ill mother, and they have
Yeah.
sacrificed their entire life, a man or a woman, for his invalid parent, not even getting married, not even having a life of their own. I have these people who are really frustrated as a caregiver syndrome. And then we have to again counsel them that yes, you must do what you're doing. It satisfies you, but you need to have some time out. So I think the concept is that whenever you're doing too much, and it starts affecting your physical and mental well-being, it's
Yeah.
time to take a time out without feeling guilty so that you're
Yeah.
rejuvenated and you can
Yeah.
go back to the work with more determination and more mental peace.
Absolutely. I think it is important to realize human, and we just cannot just work continuously without being affected. And uh, I remember when we were interns in JJ, we Dr. NH Wadia was a neurologist who was doing things with Rotary, and he had this cerebral palsy, uh, group of children. So we had, as interns, volunteered to take them for a 2 weeks not holiday, a respite in that Mud Island thing which JJ had. Yeah, it was great fun for us, but for the families, for 2 weeks, it was the first time in their lives they got respite care. So respite care is not a concept which is there as much in India, but all families also need a little bit of respite from the continuous drudgery of the work and the guilt and all of that they feel. But I still remember those families were so grateful. But we had fun because we understood cerebral palsy and what it meant, but it was a win-win. So there are different things, lots of organizations do many things, but I just wanted to highlight the great work that y'all are doing still will be enhanced if you all look after yourselves too.
And if you read the suicides which are happening in various postgraduate residents in various medical colleges because they can't face workload. So I
Yeah.
think we have so much of that because they can't cope up with the pressures. And self-care and counseling for medical personnel is so very important. We're always thinking of our patients, and time
Yeah.
has come to think of ourselves. And we as seniors need to have being mentoring the juniors how to
Yeah.
cope up the way we have coped up. Any questions from the audience? Sandeep, you can take
Any
over
thoughts?
the
Any
question
share?
and answer session.
Yeah.
So we have 2 or 3 responses are there about how the presentations were very excellent and added much practical value. So that was great. I have one question, ma'am.
Yeah.
So as a say clinicians, we are doing day in day out work. We
Yes.
feel stress of our personal lives. There are other issues going on, multiple issues going on. So how do I realize that the problem is something related to vicarious trauma, not routine stress? So are there any tests? How do I understand? So if any healthcare professional is going through this, how does he come to a thing that this I have to take care of, and it is not just my personal life which is a problem?
Yeah. So it is, first of all, being aware. What I've done is just open the surface for your thinking about how am I being affected by the work I do, and putting things in place to balance your life. I know doctors, like I worked in India for most of my life, and I know doctors work from the minute they get up till the minute they sleep, and they don't really look after themselves. And there is no professional and personal boundary that when your phone is off, it's off. You don't have to feel guilty. And taking vacations to be available and present for your families is as important for your well-being as the well-being of the patients you look after. You will look after them better if you look after yourself well. Does that make sense? You don't have to wait for having vicarious trauma to start self-care. That should begin now as a strategy to prevent vicarious trauma. I'm just bringing this as an awareness of how we as a medical profession are affected by the work we do. We don't have to work with child protection. It's seeing sick children all the time, seeing dying patients all the time, having these burden of expectation that, doctor, you are a my bap, you want to, we are going to, this child has to survive. If it's not, it's your fault, trashing you because you have not helped a dying child who was going to die irrespective of what you did. So we carry a whole burden of responsibility, fairly or unfairly, because of the expectations of society. So being able to know and sharing that understanding and preventing trauma, the whole idea for understanding it is prevented by having a work-life balance. Yeah.
Who volunteers want to comment? Nandita ma'am, you
Yes.
can unmute and speak. Please go ahead, ma'am. You can ask your question.
Nandita, please introduce yourself. I know you very well, but please introduce. And after that, Dr. Sitaram, very senior pediatrician from Jaipur. Just say one line of introduction and go ahead with your question.
If you open your camera, we can see you as well.
That will be nice when you're asking.
Yes.
Hi, Nandita. Nandita, we can't mute.
You're mute.
Is it better now?
Yes.
Yeah.
Slightly.
Yeah. Sorry, it's raining heavily outside and it's quite bad. That's why I kept my hand off, but I hope it stays off. So I work in Goa. We have the Safety Child Development Center. So our work is children with neurodevelopmental conditions right to 19 years. So we do have a lot of compassion fatigue and now that what vicarious trauma is. My question, I have one question. One is that are certain types of people, maybe people who themselves have neurodevelopmental conditions, let's say ADHD or autism.
Nandita, 1 minute. We can't hear you clearly. Can you put it in the chat box? If you put it in the chat box, we'll be able to. Till you are putting in the chat box, Dr. Sitaram, can you go ahead?
Yeah.
Can you hear me?
Yes.
Yeah.
Put your video if possible.
Oh, I'll try to.
That's okay. We can hear you clearly. Thank you.
Okay. Thank you so much for the brilliant talk. I must say, this has been bothering me for quite a number of years on how to put it into words. And frankly speaking, because of our professional definitions of these terminologies, I'm thanking from the bottom of my heart, because recently a faculty member said, "Sir, I'm actually run a child development center. I retired from my faculty position in medical college. I started a child development center." So one of my faculty, there's a young, she said, "I'm so tired. After handling all these parents, when I go home, I just don't feel like doing anything and just around." That's the time I felt that yes, things are going okay with you. Better take a break. But then she said, "No, we have to continue working." Now, could you tell me that what are the clear red flags where you exactly should stop your activities and concentrate on yourself?
Well, the red flags is when you feel burnt out, when you feel life is not worth living, you know, but you don't have to reach that point, is what I'm trying to say. Being aware of the triggers and taking self-care as part of your, day to day. So I think we as senior members of the profession have to consider well-being of the juniors we work with, not, not allowing them to feel guilty because they need time off, you know. Look, I'll tell you, I was working in India for many years. I did it was a crazy busy life. Then I relocated to New Zealand, and then I worked there for 10 years. And at the end of that, I was 50 and I was exhausted. And I said, I really don't want to work like this. I needed to take a 6 months break because I said, this is too much. I cannot do that. So I took 6 months off, and I felt good enough to go and work for the next 10, 15 years in a different space. So now what I do is I take time off, I take holidays, I take frequent breaks, I look after my health, fitness, whatever. So I think we have to support our juniors in not feeling guilty about taking the breaks they need when they need it, you know. And that's the only way. Just see what I said, it is awareness, connection, being able to identify, yes, I'm exhausted, but not reaching that point of saying, oh, I don't want to live. Yeah. We had recently in Australia, one of our child protection doctors committed suicide, and that caused, like, she was a caring individual, very this thing, but so everybody was completely shocked that, you know uh,
Yeah.
what happened, but it can drain you. So we don't want to reach those sort of stages in life if we don't look after ourselves. Would that make sense, Dr. Sitaraman?
Yeah, I think so. That's quite near about what I was expecting. But
Yeah.
is there any relation to the duration of the stress involved, age
Yep.
of
the
the
longer
person?
the longer the longer it goes on, the more fatigued you feel. So you have to nip it in the bud. If you start feeling it, take a break, go for a holiday. Actually, everybody should have a work life balance before they reach this stage. And just highlighting the importance of well-being in the work we do is really important.
Giving
Because
example, Anagha practices what she preaches. Recently, she went on a long holiday walking in Spain. And
Yes.
yearly, she takes these holidays, which de-stresses her and she can cope up with the serious work she's doing. I think age is a very controversial thing. I've seen that the more mature you get, the more
yeah,
maybe you're able to deal with resilience. So more
yeah,
senior you are, maybe you're able to cope up better. At the same time, I've seen that some youngsters deal with it
yeah,
much better because they have much positive outlook and they may have come out through a situation which has made them more resilient. So I
yeah.
think age is not really such a big factor. It's more of a personality and how have you coped up with the past experiences in your life. How much resilience have you developed as a person? I think that also carries with you when you're dealing with your work-based resilience.
Yeah, because I found something in the residents. So by the time they reach the first year, second year end, they would say, "Oh my goodness, sir, I can't do it." That way.
Yeah.
So
Yeah.
I think that's a very individual situation. That means.
I
Absolutely.
also
And
feel,
we don't know their
because of
stories. Yeah. We don't
because
know
of
We
their
don't know.
the yeah, because of the era of instant gratification in this digital era, I think the resilience and the long-term gratification or the patience to wait for something or the patience to endure, at least in my counseling sessions, I'm finding limited attention span, instant gratification, and that is opposite of resilience. So right from childhood, we need to teach our children about delayed gratification, the difference between pleasure and happiness, and increase their resilience so that as adults, they're able to cope up when they go through stressful professions.
Wonderful.
I,
Thank
I
you so
think
much.
Dr. Nandita would have written something. Can you
Yes, yes.
read it, please?
I'll just
Yeah.
read the question.
Yeah.
Question is, are neurodivergent professionals more likely to have vicarious trauma? How do you deal with the stigma which professionals want to avoid? Like thinking that if they admit to mental health challenges, they will be judged as incapable, oversensitive, not strong. So we have our own problems. So how to deal with them? One, as a neurodivergent professionals, are there any more specific vicarious trauma chances?
There's no literature which suggests that, but neurodivergence is just acceptance that it's a difference. There is no, it's not a disability. So just an acceptance of neurodivergence as a way of being, different. It's not really anything. I think sometimes people on the autistic spectrum as being different can get bullied, especially in school, especially when there's not enough understanding. Where mental health becomes a stigma, it is irrespective of whether you're neurodivergent or no. So mental health should not be a stigma. It should be something everybody needs support with. It be it should be a safe place. So when I say safety, I mean the workplace has to be a safe place where they can talk about their challenges without feeling judged. And that is where supervision comes about having somebody there where they can talk about their challenges and finding the right persons who understand their dilemmas and not considering it as a stigma. I think we have a long way to go if we think that anxiety and depression becomes a stigma, because it's just a way of life. Everybody can get, and it's not a continuum, right? You can get anxious about something and you can be fine. You can get depressed about something and you can be fine. So it's a sort of journey. It doesn't have to be a stigma. And the more we accept that the work we do can cause us to be anxious or us to feel low, the less stigmatized they will feel. I don't know of any literature, but I do know that neurodivergent, I mean, it depends on what you're talking about. If you're talking about ADHD, that's different. If you're talking of autism, is different. If you're talking of which particular specific neurodivergent population.
If I can just add, yes, mainly ADHD and autism, because we know that since especially people with ADHD generally tend to go in high risk situations and because they're good in crisis, so they are overrepresented in like emergency room, even in developmental pediatrics and so on. So the thing is, yes, we know it should not be stigmatized, but this is very common in India. Even when doctors have neurodivergent children, it's hardest for them to accept. It's much easier for other professionals to accept because the whole status is linked with it. But I completely agree. I think more and more we need to talk.
So with neurodivergence, it is really important that we all learn to have neuroaffirming language. Okay, so neuroaffirming language means looking at the superpowers of children with ADHD. What is success mean if you have ADHD, and rather than making it as a disorder which needs medication. Maybe one day we can do a talk on understanding ADHD for teachers and parents. That could be something, because
we should do that, Anagha, because I mean, a number of talks and should be covered.
So
and we have to have a talk from you.
In fact, I am a self-advocate.
Sorry?
I said I'm a self-advocate with ADHD.
Yeah.
And it helps. It helps. Yeah. It does kind of make us fearful. Yeah, I think.
I'm actually doing a talk on Tuesday for teachers in one of the clinics I do. It's a remote area on understanding ADHD and looking at the executive functions and understanding, the superpowers of ADHD rather than, calling it a disorder.
I have been called ADHD without the attention deficit. So I think I can also advocate.
No. Thank you so much. I'm sorry I have to leave. I have an appointment, which I've already kept.
Yeah, no. Thank you for joining. I hope this was not completely way out. I just thought it's something it would be important to share. Yeah.
Okay. Anybody else has any questions? So, Anagha, please connect with Samir. We will have a session on ADHD, especially practical tips for parents and teachers to understand be really useful. Yes, Samir?
Yes,
Samir
madam.
is mute.
No. Yes, I am just hearing a very excellent interactive session that was going on.
Did somebody have a talk on ADHD before? What was
We
covered?
had one. So we have, but as I said, Anagha, there are so many aspects and dimensions to ADHD management. So even if you have had one in the past, doesn't matter. We would still like to have your talk on tips for parents and teachers how to manage.
Yeah, I think just like what I said, understanding Vicarious trauma, I'm happy to do a talk on understanding ADHD.
Yeah, that'll be really good.
Yeah.
Okay, so shall
Thank
we
you
wind
very
up? Is
much.
there anything more, Sunny?
We can.
Yeah, so it was wonderful, Anagha. We look forward to more
Yeah.
sessions from you.
Excellent. Thank you very much. Thank you.
Samir, can we wind up?
Yes, madam. It's a really great session that what we are discussing till now, the different situation of that related with our patient stress level. And now when we are discussing our own stress, really it will be really impactful when we are treating our patient stress. And if we not treat ourselves, it will ultimately lead to the more and more problematic to the our patient-doctor relationship also and the long-term family relationship also. And short breaks, what Anagha madam has told is very rightly, it's a really a very important to take even any situation or the anything what you are doing, not only for the our regular OPD or the our patient work, but the regular monotonous work. When it making us stressful, you have to take a break of that thing. That's a really a moral of this story. But I get the message, and we can definitely conclude today's session with really we think that we have to continue such type of this session for the our own health benefit also. So that's a thanks a lot, ma'am, to take a excellent time from the Australia. No doubt it's a difficult time for you, but Swati madam has also joined and you have also joined. So thanks a lot for the all participants. Thank you.
Just to inform Anagha, I've been taking lectures on stress management for undergraduate and postgraduate students at DY Patil, and I've also taken for Sassoon Hospital. So I think we should
That's
start
wonderful.
teaching them from that time. So that stress
Excellent.
management is part of self-care.
Understanding, being aware that you can be. Yeah,
Yeah.
absolutely.
Okay.
Thank you very much.
Okay. Samir, you want
And
to just announce?
yes, ma'am. So this is the next upcoming our activity on the next Monday. We are having just end of the our week the day tomorrow. But if on the Monday we will still continue with one more session related with the parenting, with a specific unique topic that should be just front of the paper. Everybody is reading. That is who responsible. The key to underage drunken and driving. It will be the session that will be taken by the main key speaker by Dr. Samir Dalwai, expert comment by Dr. Swati Bhave, and then we have a personal parenting experience by our four adolescent handling parents, and then we will conclude that session and our whole week. So I expecting each and every participants of today's webinar, please join at Monday 8:30 p.m. with this discussion. Thanks a lot.
Thank you. Thanks
Bye.
you for accommodating my time. Thank you very much. I appreciate
Bye.
it.
Thank you. Thank you so much.
Bye-bye.
Okay. Bye.